Bone, joint, and muscle injuries. Bone, joint, and muscle injuries are very common in children. Bone fractures always require medical attention, but joint and muscle injuries may not be severe enough to require it. In the event of this type of injury, first response is a series of steps called RICE. R is for rest, I is for ice, C is for compression, and E is for elevation. Rest. Do not move the injured area. If help is expected soon, that's all that's necessary. If help is delayed, you'll need to splint the injury to keep the area stable. We'll go over splinting in a minute. Next, apply ice. Place a cold pack or bag filled with ice water on the injury to reduce swelling and lessen pain. You can leave it on for up to 20 minutes, 10 if it causes discomfort. Then remove it for 30 minutes. Repeat the process for 24 to 48 hours or until medical help is obtained. C is for compression. Use an elastic bandage on the injury to reduce internal bleeding and swelling. The bandage can be wrapped over an ice pack. Elevate the injured extremity to keep the swelling down and reduce possible internal bleeding. A sling may be used for arm injuries. If medical attention is more than a few minutes away, or if it's hard to get the child to rest the injured area, you can use a splint to immobilize the injury. There are 3 main types of splints: rigid, made of wood, plastic, or metal, a rolled newspaper or magazine, or thick cardboard. Soft, made from a pillow, blanket, or towel, or a triangular bandage folded into a sling. And anatomic, using an uninjured leg, finger, or toe to stabilize an injured one. The splint should immobilize the entire injured area, including the joints above and below it. Support the leg while splinting. Position the leg on the splint and then secure it to the splint using a roller bandage or strips of cloth. A sling may be used for arm injuries. After the splint is secure, check the extremities for circulation.